If you wake up with headaches in the morning, feel like you clench your teeth during the day, or have historically broken teeth or crowns, you may find that you are grinding your teeth at night. Because it is a subconscious habit, you may exert impressively high amounts of pressure on your teeth. Over time, this can damage your teeth, supporting structures, and your jaw joint. The reality is that it is very common. It is known that clenching and grinding can increase with stress, and this stress can be psychological or physiological. If you clench and grind your teeth, you are normal, and like many others, there is a treatment option to help prevent further damage to your teeth. Protecting teeth can be through wearing an occlusal splint at nighttime, or through strategic restorations in your mouth to reduce damaging forces. Many patients get on very well with wearing a splint at nighttime, and some patients often report that they can't sleep without it. Splints are made of hard acrylic. This is so that it can evenly distribute forces. However, acrylic is softer than enamel and dentine, which make up your teeth. Therefore, if you continue to grind whilst wearing the splint, you will damage the splint and not your teeth.